Dr. Shi presented data, the first data that we had seen, that showed that the number of primary care clinicians in general, actually family physicians in particular, the number of primary care physicians per 10,000 people was a major predictor of lower cost and better health outcomes. That not only was primary care inexpensive, but of all the health-related services that are available, turns out that only primary care is associated with better health outcomes, longer life expectancy, less infant mortality, less heart disease mortality, less cancer mortality. Everything we measure is better when there are more primary care clinicians. And the cost of health care is lower when there are more primary care clinicians. That research was validated by other studies, but that was the first time we knew that with certainty. So in 1 year, we learned that primary care is ridiculously affordable, so affordable that we could easily afford to give it away. We learned that it was effective and it was associated with lower costs. So it's kind of the triple threat. It became, in my mind, the service that we just should provide to all Americans.
Sure. And all three of these tendencies seem like they lead to one another. More doctors, better care, less invested into the health care of each individual. These things lead to one another as stepping stones.
And it actually works pretty simply. When you have primary care doctors and practices available, when somebody's sick, they go to see their primary care doctor. When there aren't primary care doctors and practices available, people, when they're sick, go to hospital emergency rooms.
That's awfully expensive.
Which is way expensive. So today, if someone goes to see Dr. Richter with a headache, she knows that that person's trying to take care of their aging parents and has a high school kid who may be having some issues. And that person probably is working 2 or 3 jobs, probably isn't getting much sleep, and that's the source of the headache. Or something like that, because she knows the person and she knows the community and she knows the family. She leverages that relationship. So what she's going to be able to do is, sort of make some simple suggestions, and my guess is it probably ought to cost $150. My guess is she probably gets paid about $75 for that one service, but somebody paid somewhere between $75 and $150. Am I right? I don't know what the Vermont numbers are.
That's roughly right, yes.
That same person, when they walk into the emergency department of a hospital, first of all, half the time they took an ambulance ride to get there. That's a fast $400 to $1,000. Then, because they had a headache, and they're being seen by somebody who doesn't know them from Adam, they get a CAT scan,
right.
An MRI, often a consultation from a neurologist. Sometimes they stay the night. So on average, that $75 to $150 cost,
a premium cocktail of services,
suddenly cost something like $5,000. If they got admitted to the hospital, it goes to $15,000 for what we could have bought for $75 to $150.